Hello, everybody. Dr. Carmen Bryant, redefining yourself. Happy Tuesday, whatever day you get this video. This is my Monday, and so this is the great Northwest. I would turn the camera around and let you see the beautiful clouds and the rain. I just want to come on. Remember, Redefining Yourself is a program that I developed focused on women that are thinking about leaving, so contemplating leaving, needing more information, or recovering from domestic violence, specifically narcissist abuse. Hopefully you've been following my YouTube channel. If you have not, please go subscribe and hit the bell so that you can be reminded every time I post a new video. It's Dr. Carmen Bryant with a T. Overcoming narcissist abuse, and there's videos on there that talks about narcissist abuse, what narcissist abuse is, what it's like when you're contemplating leaving or leaving the relationship, brain damage, from abuse, narcissist abuse, or domestic violence abuse, period. The studies concerning that. So there's a plethora of information that I have been posting on YouTube, and hopefully you take the opportunity to go follow up. I will be coming on Periscope soon. For those of you that have been watching the videos, I'm just going to recap on a lot, and whatever happens while we're on Periscope happens. You're welcome to ask me whatever question. Please take the opportunity to comment, in the comments below for YouTube, or on Facebook, on my professional Facebook page, Psychological Health Consultants and Services. So I just want to come on today really quick, and I wanted to tell people, stop rushing people through their grief and mourning phase after they've left a domestic violent relationship. We deal with the grief and loss. In the clinical setting, we deal with grief and loss. I'm a therapist, however, I'm not for everyone, and I still have to understand my limitations when it comes to people that are grieving, but I also have to understand the type of relationship they've been in. If you've been in a relationship that lasted a week or two, you can't expect someone to get over the grief and loss process, or get over the process of mourning a relationship that they've gotten out of if they've been in a domestic violent relationship for over 20, 30 years. Go watch my trauma bond video. You can understand, why some women, and this is even though the program is developed for women, keep in mind, men go through the exact same thing. And there is one on there, the female narcissist. So this applies to men as well. It just so happened that the program is more focused on women. But you are also welcome, men, you're also welcome to comment. You're also welcome to ask me to talk about anything you'd like me to talk about. I'll be more than happy. Thank you for those of you that have been sending me emails, and those of you in private. But I just wanted to say, stop rushing people through the process of healing, and understand your limitations as a professional. I too, I'm a licensed mental health counselor. I also deal with the grief and loss process, and I'm also a certified life coach. There are some certified life coaches. They're awesome, but they're not mental health professionals. Me, along with some other life coaches who've decided to take the life coaching and leave the mental health, the clinical side of the house alone, do understand our limitations and understand that when you go into life coaching or advising or school advising, you have to understand your limitations at the information you provide for people. You can't tell a person that you have 2 weeks or a month or a year to get over their traumatic loss, because you don't understand, or some people really don't understand the effects of the trauma that they've experienced. There's a difference between losing a loved one, to natural causes, as opposed to losing a loved one in a traumatic incident, car accidents, murder. There's a different process for each person, and then you don't know what their past experiences were when it comes to trauma. Even in a relationship, when you're dealing with domestic violence or narcissist abuse, you don't know how long. Number one, if the relationship is a long relationship, don't expect a quick recovery. And if it's a short relationship, that doesn't necessarily mean they still have a quick recovery. They also have a history, so we don't know where they come from. We have to talk to them, and I was looking at this page when I was talking about some of the grief symptoms. We talked about the 7 stages of grief previously, and people, there's a myth that says you have a year to recover. Okay, normally when grief has happened or a loss has happened in a person, for a person, you'll notice that, everything is very intensified. Well-meaning people say the wrong things sometimes. Well-meaning people like, it's going to be okay. I understand what you're going through. Stop saying that, because you don't know what they're going through. You don't understand what they're going through. You are a different individual than they are. Their experiences is different than your experiences. Even if you've had the exact same loss, loved of a parent, a spouse, grandparent children, you still don't understand their level of grief because you don't understand their history and how it affects them. Grieving, most people, when they begin to grieve, you'll notice within time they'll start getting better. A lot of times, even as a therapist, when I've had hard cases where children have committed suicide and the family is in, sometimes it's better not to say anything. I just sit and I be with the family. I've even shed a tear with families, and at least they understand that I care. I can empathize, with them. Sometimes we say too much in hopes that we can make someone feel better. Sometimes it's not good to say too much. And then especially if you're dealing with a woman that is coming out of a domestic violence situation, whether they've been discarded or they made the choice to discard, you don't understand that sometimes the narcissist is still abusing them from afar. So the things that you're saying to them, they become defensive. And a lot of times they're so hurt, they're so, that takes a long time in a counseling to change a person's thought process. You're having to change. Remember, you having to redefine everything that the abuser has defined them to be. And on top of that, now they're dealing with a tragic loss and how deep those emotions run. You don't know how long they've been in that relationship. Stop rushing them through the process. That's not fair to them. And a lot of times people won't stay, I'll give you another example. Sometimes they won't stay with you in counseling if you're trying to rush them through, because you may have been through something, but that doesn't mean that they've been through the same thing as you have. So sometimes people tend to rush people through the process of healing. If you're still reliving the event in your head, and especially if you have post-traumatic stress or complex post-traumatic stress, you don't know what's going on in that person's head. Intrusive thoughts, actually sometimes they walk around still arguing with the person in their head, and that person is not even there. The person is not even there anymore. They can hear the screams of their kids. They can hear their own conversations, and they'll replay those conversations over and over and over again in their head. So now you're not just dealing with the loss of a relationship, or the breakup of a relationship. You're still dealing with the residue of the post-traumatic stress and the voices that they're hearing in their head. Now, keep in mind, when I say voices that they're hearing in their head, I'm not referring to schizophrenic, the schizophrenic signs and symptoms. I'm not talking about schizoaffective. I'm not talking about psychotic episodes. But, to have intrusive thoughts, to actually relive the event in your head over and over and over again. Now, if they've been in a domestic violence relationship for years and years and years, they're not just replaying one event in their head over and over again. They're replaying many events over a matter of years and time. So when you're dealing with them based on what you're witnessing, meaning the breakup of the relationship that you don't understand. It's complex. Immediately is complex grief because of the fact that on top of that you have PTSD associated with it. Then on top of that, they're blaming themselves for staying in the relationship, and on top of that, they're looking at the chaos of the debris, from the relationship itself. Broken relationships, broken children, children that are needing counseling. How was I not able to defend my children? How did I find myself in a position like this? I work here, I do this, how did I end up like this? So you're not just dealing with the grief process itself of the breakup. Remember that. And then on top of that, even me as a certified life coach, if I'm working in that capacity, I still have the mindset of a therapist. That kind of benefits me because I know what my limitations are in the coaching process. And you have different types of coaches. You have coaches that are helping you through business. You have coaches that are helping you define yourself, help you recover from something, find joy in life. But mental health professionals are trained specifically for emotional problems. I've talked about the DSM. In the DSM-4, we're in the DSM-5 now. In the DSM-4, which was the previous edition of the Diagnostic Statistical Manual, we were still working off of the axes. The axis, which is the mental health and emotional. Axis 2 is the personality disorder and so forth. If you go read, now we don't really deal off of the axis anymore. Some of us old school therapists still use that kind of as a gauger for us. What influences socioeconomic statuses, health issues, financial issues. Those are all a part of assessing someone, how does that play a role? Well, because of the fact that mental health providers are trained that way, our minds think like that even in a coaching process. And so we have to understand our limitations as to, what crosses the line of coaching and the boundaries to mental health. I have seen some coaches, or I have even talked to clients that have had coaches that have totally overstepped their boundaries as a coach. Even though they're getting education, they're being trained, they're talking to other professionals in the field, they're talking to mental health professionals, they're talking to psychologists. That does not mean that you are qualified to provide them with counseling. You have to understand your limitations when it comes to assisting, and that's coaches or even helpers alike. You have to understand your boundaries when it comes to people that are going through a grieving, loss, and mourning process. And like I said, know your boundaries, and you have to swallow that pride. You can't be a helper, filled with pride, thinking that you have the answers to everything. Even me, as long as I have worked, even with a doctor's degree, I still know I have limitations. Every client is not for me, and I'm not for every client. And I have to, and it's not about money. If it's about money, you're going to make a lot of mistakes. There are things that I have done for free, and this is for you professionals. There are things that I have done for free to help out clients, and if it's all about the money, then you're going to make mistakes, because you're going to want to fix every problem. You're going to not want to lose your clientele, and you have to know when it's time to refer out to a professional. And for those of us that are also working in the coaching field, you have to know when to stop the coaching process. I don't care how good the money is. You have to know when to stop the coaching process and refer them over to a mental health provider. And there are too many coaches that are crossing the boundaries, that are giving mental health advice. And right now, I know that this the coaching is really not one that's monitored monitored or licensed at a state level, where the states have a say in what you can and cannot do. And so it can become dangerous if you don't recognize your skill sets and recognize the boundaries, and not cross over in the mental health field. Stop telling these people that, you have 2 weeks to recover, you have 6 months to recover. Everybody grieves differently, and every situation is different. You have no idea, especially if a person is going through post-traumatic stress and chronic or complex post-traumatic stress, based off of the many years they may have been involved in a domestic violence relationship. You don't know what they've been through unless they tell you. But sometimes, not sometimes, you just have to remember that domestic violence and narcissist abuse, which is still being studied, there's no definitive answers or definitive causes. This is a situation that's still being researched. I was reading on, I believe it was Psychology Today. I can't recall the name of the researchers, but the estimated amount of people in the United States, I think, is 326 million people. And of that, in the DSM, it has that 6% of the population has narcissistic personality disorder, or 6% of the people lack empathy. So when they did the numbers, and I don't know the exact number, I posted it on my professional webpage, I think it was like 19 million people are walking around with no conscience. They lack empathy. Narcissists, and then on top of that, they are abusing people. So I think it was like 6 million more, 6.7, I think it was. I'm not sure about the numbers, are a result of narcissist abuse. And it's still a very it's not a, when you're talking about schizophrenia, you're talking about major depressive disorder, those things are well studied, longitudinal, all these studies that are going through, the best study that you can have is a person that's been through it themselves. If they've been in a narcissistic relationship for over 20, 30 years, the best information you get is from the survivor once they discover what they've been through. Ask them questions about some of the things. Everybody's experience is different, and so you can't judge a grieving process or a mourning process, and everybody grieves differently. Some of the most happiest people committed suicide. You never knew it was coming. You couldn't believe they had us so well and they were such a happy person and committed suicide. Because society tells us this is how we're supposed to deal with grief. Society has given us, boundaries, and this is how long it should take. So how long it should take to get over the grieving or the mourning or the loss, of a relationship. So society is telling us, and so guess what people do? People think that they have to conform or they're abnormal. And then you're dealing with an individual that's coming out of a domestic violence relationship. They're already confused as to who they are, what has happened to them, and the extreme pain that they're going through, and compiled on top of that, PTSD, complex PTSD, and now society is telling this individual it should only take you 6 to 12 months to get over this process. No, that person needs to be in some type of therapy with a professional that understands violence, domestic violence, and understands complex grief and complex grief and loss process. I've talked about the 7 stages of grief. Everybody doesn't go through all 7 stages. Everybody doesn't go through all the stages. Everybody doesn't go through them in order. Some people return back and forth, and usually when they come into counseling with me, I have to determine where they're stuck at, because some people are, after years and years and years, are still stuck on one of the 7 stages of grief because they've never allowed themselves to process through. Some of that comes along with the way that they think, I shouldn't be able to get beyond this, and some of it comes from people telling them, or they feel guilty at being able to enjoy life, and the fact that their children may have been affected by what they see, so they feel guilty about enjoying life when their children are still struggling after being involved in domestic violence. Or some parents and women who watch their children go through the same process as they went through. You can actually see them going through the same relationship mistakes, abuse, or becoming the abusers, after that. So now, on top of the grief and the guilt of being in a relationship so long, now you're watching your children go through the same thing. So for those professionals that are watching, and for those of you that are friends and family of those that are going through grief, be careful what you say to them. You don't understand. Your best bet is to advise them to go seek a counselor. Go seek a professional that is well versed in grief and a trauma-based counselor. Look at their credentials. Shopping for a therapist is just like shopping for a car. You have to find a therapist that fits your needs. Those that desire a Christian counselor, look and see if they're a Christian by credential or Christian by belief. You have the right to interview us. And we have the right to interview you, because we also determine whether or not you're a good fit for us, and you determine whether or not that counselor is a good fit for you. Do they have some of the same principles? Do they have some of the morals? Talk to them. Some counselors, I don't. Some counselors do a free 15-minute consultation. Normally, because of the fact that I'm a trauma-based counselor, I usually go straight in. And for me, usually the consultation turns into a whole session, and I know, because that's the capabilities that I have. But you go and interview. You come in and you let them know, I would like to make an appointment with you. I just want to talk. I want to feel you out. I usually tell them, you're welcome to ask me whatever you want to ask me. Some of them are bold enough to say, have you ever been through abuse? And I tell them, yes, I have. Some of them say, have you ever been married? Yes, I have. I've had clients tell me, what are you going to tell me? And you're not married anymore. I can tell you a lot about the parts or the mistakes that I've made in the marriage, but I won't take the, I won't take the blame for the abuse, and so some of them stay and some of them don't, but you have the right to interview your therapist. You have the right to ask questions to see if you and this therapist are fit or meant to be together. Every person is different, Every person is different. I have a military background. I have a lot of military people that come to me because we speak the same language. I talk with my hands. For those people that know me, I talk, and when I get really excited, I get really intense with my hands. Well, in the military, that's what we did. We talked with our hands. Everything we talk with our hands to make a point. But when you're dealing with a person that has been through, trauma, sometimes this right here can be very, it can be seen as very aggressive. It can be, because this is what when you're dealing with an abuser, a lot of times they've used their hands, or they're accustomed to their hands being used on them. And so, to be sensitive to people when they come in, I'm a very straightforward person. If there's an elephant in the room, I'm going to point it out. Some people can't handle that, and so I have to adjust to the people that are in counseling. I know how to make it people-centered, and to adjust and talk about it. And if they feel offended or afraid, to open up and give them the opportunity to express themselves. So you have, ladies and gentlemen, when you're out looking for a professional to deal with the trauma that you've been through and the grief process that you're going through, interview your therapist. Ask them questions. Ask them, have they worked with people that dealt with trauma? Some of them want the clientele, and some of them will just say, yeah, I've dealt with many people that have been through trauma. No, ask them specific questions, and then on top of that, find those that are culturally appropriate for you. And I say it all the time. Every Caucasian therapist is not meant for a ethnic family, African American family. And then there are some Caucasian or whatever nationality that are really good with ethnic families. They're really, really good. They've learned, they've talked, they've asked questions. We learn in counseling just like you learn in counseling. When I have people of different cultures that come in that are not of my culture, and just to let you know, I'm African American, y'all. But when people come in and they're not of the same culture that I am, you have those that come in that are of the Hispanic descent. You have those that are have Muslim women that have come into counseling with me. But I ask them questions, and so I try to relate to see how our thinking, or some of the training or things that they've been brought up, what are the similarities. And people appreciate it when you show interest in their culture or in their nationality or their race. So you interview, you talk, you learn, and that's how I learned. And many of the clients taught me, even of the Korean culture, of the Chinese culture. You have the Native American culture. They teach, Native American here in this area. A lot of them are not, the handshakes. We grip really hard and we handshake. A lot of them see that as being aggressive, and so you have to learn how to handshake. Some people want a hug. Therapists, be careful with those hugs. In my clinical setting, I don't do hugs with clients. I keep it professional, because a lot of them that come in that have been sexually molested, domestic violence, you have to watch that, especially if you're dealing with a woman or a man that is a narcissist. They'll use that. If you desire hugs as well, they'll use that against you to pull you in. My thing is I don't touch. Ethically, professionally, I'm teaching them new boundaries. And so you guys have to be careful. Be careful, be careful, be careful. Stop telling people how long they have to. You don't know what they've been through. Some people have been through some horrific things dealing with domestic violence. Some people have been through some horrific things, especially dealing with narcissist abuse. Some violence, you can see the broken bones, you can see the scars, you can see the missing teeth, you can see the scar. One lady lost her hearing, one lady has no teeth, one lady has a scar in her face, one lady has a scar in her neck. People carry scars, physical scars, but psychological scars sometimes run very, very deep and very, very long. Do you know that when your body goes into stress, and we've talked about this before, when a woman is living under that amount of stress, that type of abuse, and remember, the narcissist always wants to keep the atmosphere under a high level of anxiety. They always want to bring in chaos and confusion so that they can have their way. It doesn't matter if you're smart or not. They'll always try to use confusion. They'll always use anxiety. They'll always, everything is fear-based. Everything they wanted, they get their needs met by manipulating, by lying, so the level of stress is very, 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 very high. But eventually it's going to start making you sick. If you talk to women that have been in domestic violence situations for a long period of time, a lot of them have gastrointestinal problems. They have reproductive problems. They have migraines. Some have hair loss. Some of them you would assume are bipolar or borderline, but it's the chronic, that complex PTSD. Even the symptomology may look like one thing and it's not. So they're being mismedicated, they're getting the wrong medication, and really no one really took the time to really assess. Why are we not assessing like we're supposed to? I know it's time consuming, and I know for a lot of us, we don't get paid to do a good assessment. We really don't. But think about your client. Think about the person that's coming in that's dependent on you. They trust what's coming out of your mouth. They trust that you're going to take care of them. And even if it means, for me, a lot of times it means that I'm not going to get paid what I'm supposed to get paid, what I'm worth being paid. But that comes at the price of making sure that someone is taken care of, making sure the diagnosis is correct, making sure that I know that, okay, you're not bipolar. You're not even borderline. What you're dealing with is complex post-traumatic stress disorder. And a lot of times they take those evaluations to their med providers and they change the medication up, and they're more calm when they come in, and they have more respect for you. They have more respect and they trust you. Remember, you're in a field, whether you are a life coach, whether you're a mental health provider, you are in a field where people, even clergymen, those in the medical field, even lawyers, they trust you to protect them. They've been, these men and women have been through trauma. Men have been through, women can be vicious. Sometimes they run their, I'm a woman. Sometimes I've watched women just tear a man up. It just really irks me. It just, the things that they say, how they humiliate them, how they embarrass them, even to a point where the women put their hands on a man, and that man may not be a fighter. In other words, he's been taught not to put his hands on women, and so the woman would take advantage of that. Hit him, throw stuff at him, humiliate him, dog him out, talk to him any kind of way in front of his children. I've seen it. And likewise for women, remember, if you looked at the female narcissist, the one that I did on YouTube, some of the females like dominating. They want to dominate. They want to dominate. Men want control, want control, want control. So when you have people that are grieving and going through the grief process, when you have people that have broken up from long-term relationships and they have been abused, you don't know their history prior to that either. You don't know some of the details. Sometimes they're too embarrassed or too ashamed to tell you some of the things that they were forced to do. Forced into prostitution, forced into orgies, forced into open relationships, all because they loved and trusted this man and they took advantage of him. Some of them know that their children have been abused. Some of the women that are in the relationships were sexually molested at a young age, and their minds can't handle the fact that there's a possibility that the children could have been molested even by the narcissist. Even watching the behavior of a narcissist, when you notice, there's some women that noticed that they had the grooming. They were grooming kids. They were grooming the kids, or they began to watch the kids, and when something was said to them, the women were told that they were crazy, you're jealous, anything. You don't understand sometimes, and you have to be empathetic to people when they're grieving and breaking up from a relationship. You don't know how deep the wounds run. You don't know how far the scars have made it into their hearts, even to a point where they don't trust people around them, and then a lot of times their behavior is almost, sometimes the behavior of a hurt person makes you want to get away from them. And sometimes we have to be sensitive to recognize that behavior is almost like a cry for help. It's a cry for help. And so I just wanted to come on and really just tell people, stop telling people how long they should take in grieving. Stop telling people what is the right way to grieve and the length of time, because you're putting limitations on them. So now they feel obligated to get over it, to get right back into another relationship. Ladies, if you're coming out of a relationship with domestic violence, take your time to process. Take your time to heal. The longer the relationship, sometimes the longer it takes to recover. You don't have major surgery. Like I said in another video, you don't have major surgery, had your leg amputated or had a major organ taken out of your body, and then the next day you go to a swim meet or play football or soccer. So if you can use those medical, you take the medical advice from a doctor, then why can't you take the advice from a mental health professional? Sometimes it takes time. It takes a while to heal from the trauma that you've been in through. Never let someone dictate how long it should take you to grieve. For some people, it's taken a few years and they've decided to be single so they can get that residue out of them, because you'll be triggered by every man that sounds like, looks like, smells like, you'll be triggered. And if you're still triggered and you're still responding, that means you haven't got it out of your system yet. It's a process. take your time. You don't have to be with a man. You don't have to be with a woman. You don't have to have a partner. You don't have to, I don't care if you have kids or not. You don't have to be with someone. But what you have to do, and you're obligated to do for yourself, is to heal your emotions and heal your mind and get better. You are fabulous. You are great. Men and women, kings and queens. That's what you are. Hopefully this has helped you. I didn't want to stay on very long. I didn't have a whole bunch of stuff to read today. I have my little iPad in here. I try to change the scenery. It took me a few minutes to change the scenery, and use this pod stand. It kept falling over, but hey, I appreciate you guys. I really do. Thank you so much for the emails that you guys have been sending me, the comments, the inbox messages on Facebook, even to ask questions, is this abuse? Is this not abuse? What about this? People dealing with the legal system, Listen, one thing that I tell you guys over and over again, if you've been in domestic violence, especially narcissist abuse, but if you've been in domestic violence, go find you a victim advocate. I have a friend of mine that's a victim advocate, and she tells me about, some of the things that she has to experience when she goes to court. She's really good at what she does. You guys go get a victim's advocate that can help you through the process, because when you are, recovering from abuse and some of the things that you've seen, one thing that the abuser expects you to do is to act out of character. In other words, act a fool. They're expecting you to do that to prove a point in the court. And your best bet is to trust your lawyer, trust your victim advocate, and trust a therapist. Get a therapist so that you can learn to control those emotions, because they always expected you to be reactive. Now is your time to use some wisdom and use some knowledge and use some information that's been given to you. Thank you so much for watching. Please go subscribe to my YouTube channel, Dr. Carmen Bryant with a T, Overcoming Narcissist Abuse. Please go to my Facebook page, my professional Facebook page. It is Psychological Health Consultants and Services. Please, if I don't know you, I'm not going to allow you to come on my personal Facebook page. That's for personal friends and family, but I will talk to you on my professional Facebook page. Stay tuned, because I will come on Periscope and begin periscoping. I'll try to go over some of the material, but you're welcome to come on there and ask me anything. It's live, so you could ask me anything. It can go any kind of way. I'm more than happy to talk and discuss with you about domestic violence, narcissist abuse, specifically narcissist abuse. Thank you guys so much, and as my friend always says, go and be great.